1. We are live now.
Good evening and warm welcome to the 9th session of Healthy Life Initiative of OrthoTV. I am Dr. Dhiren Ganjwala. I am a pediatric orthopedic surgeon practicing in Ahmedabad, and I am going to be the host for this session. The aim of this webinar series is to discuss various aspects related to lifestyle so that doctors and the non-medicos both are encouraged to adopt healthy lifestyle. The salient feature of this webinar series is that we discuss scientific information without any commercial influences. There is no support, no commercial support to this webinar, and that's why we are able to discuss without any influence from the industry. The topic for today's webinar is cardiorespiratory fitness. For many years, it's said that health is wealth. This is true for everyone and at every stage of life. The aerobic fitness of recommended that everyone should carry out 4 types of exercise. That's recommended by American Academy of Sports Medicine. And one of the exercise is aerobic fitness. The aim of aerobic fitness is to improve the cardiorespiratory fitness, that is fitness of heart and lung. In this session, we are going to discuss about how to choose the aerobic exercise and how to avoid problems, because this is one of the major concerns of everyone. Now and then we hear that someone passed away with a cardiac arrest while carrying out exercise, and that is really bothersome to everyone. We have 3 experts with us who are not only a great clinician, academician, but they are also fitness enthusiastic. The Dr. Raghav Dutt is a spine surgeon in Hyderabad. He was a president of the All India Spine Society, and he practices in Hyderabad. Dr. Srinivas Rao is an orthopedic surgeon practicing in Rajkot, Gujarat. And Dr. Manohar KN is a diabetologist practicing at Manipal Hospital in Bangalore. And all the 3 have a great interest in fitness. It's not only the interest, they are carrying out a great aerobic fitness with a great enthusiasm. The disclaimer before we go into the session that the knowledge of this webinar is mainly for education and information. Please consult your doctor before you put this into the practice. OrthoTV, our experts are not responsible for any problem arising out of the knowledge which we are discussing today. If you have a question related to any topic, please ask us the question on a WhatsApp. The number is 97129 25600. I repeat, 97129 25600. So with that, we start the session. And I would like to ask the first question to Dr. Raghav Dutt. Sir, can you explain to our audience about what is aerobic exercise or what is cardiopulmonary fitness in a very simple word so that we understand what is that?
Good evening, and I'm so glad that you're doing this series for fitness, especially for orthopedic community who are mostly unfit. They work hard, but I don't think they are mentally or physically fit, which applies to all of us. Now, aerobic exercise is just another structured physical activity. During this activity, we consume the oxygen to the max, and that produces the energy required to do the exercise. That is the theory behind the aerobic exercise program. So, as I always say, these exercises have to be inculcated in the life of every practicing orthopedic surgeon and every individual at all ages, even after retirement, even when you are 85, 90 or whatever, till the last day of your life, you must exercise. Of these, aerobic exercises are really the very best. And it is true that there are examples of people dying or suffering massive heart attacks, etc. But if you look at the general population and the statistics that we have in our own country, people who exercise have far lesser chances of heart attacks and strokes compared to the overall population. And then not exercising will lead to diabetes and 100%. Because now I'm told that every Indian is a diabetic unless proved otherwise now. That is a situation we are heading into. And situations like thyroid and mental stress is ultimate in our country. Children are the maximum sufferers. So you must start aerobic exercise program. And to put it simply, any exercise that makes you slightly breathless is good for your heart and lungs. I can't put it less simpler than that. And your sweat should be wet with sweat, whatever you are wearing. Not because of the heat that we face in Hyderabad or the sultry weather, but with exercise. If your clothes are wet with sweat, and if I'm allowed to demonstrate like that, you should feel at the end of the exercise, you're doing a good job for your heart and lungs. I hope I have answered that question.
Yes, so you really explained that during that time you should be slightly breathless. And I
Yes.
distinctly remember that last time you mentioned in the first session that if you are walking, it's not an exercise or it's not going to give you benefit. So a lot of people, they were really surprised with that sentence. But the reason is that when you are walking and when you are particularly talking with your friends, probably you are not walking at a speed where you are really become breathless, and that's probably, it's a good exercise for calorie consumption, but it's not really a very useful for improving our fitness. So yes, your point is very correct.
If I'm allowed to interrupt,
Yes, sir.
even let us say, how can we say it is a good exercise? Because see, if you walk 4.5 kilometers, I stand corrected, you lose about 150 to 200 calories, right? Let us say on an even ground. For 4.5 kilometers is roughly 40 to 50 to 1 hour exercise for various individuals. Now, if he goes home and eats 2 bananas, he has actually wasted his time doing this exercise. So, yes, walking is a good exercise for patients who had a bypass or a kidney problem or a cancer. For a normal, fit orthopedic surgeon, I don't think it does much. Yes, I'm sure there are a lot of doctors who will object to what I'm saying, but I stand by what I say. It hardly does anything to the human being. And
Yes.
human beings are not made to walk, they're made to run, they're made to climb, they're made to live in forests, and were made to hunt. So we have forgotten the art of running and physical exercise.
Yeah, that's the effect of industrialization, and the cultivation and the agriculture has really made a lot of change in our life. I would like to ask a similar question, but this will be now to Dr. Rao. Like, what are the different type of aerobic exercise? Because as Sir said that running is one of the exercise which we are all aware, but what are the other options?
Right. When we talk of aerobic exercise, the first thing that comes to our mind is running. Running, jogging, sprinting, indoors, outdoors, anything is okay. Running is good. Running is one of the first aerobic exercises, which fortunately you don't need a lot of facilities for running. You can just wear your shoes and go. I think you need good shoes. And if you give a choice, then a soft ground, not the concrete or the tar. But that nowadays, that's a premium commodity. The second, of course, is cycling. Riding a bicycle, stationary or on the road, is good enough. Unfortunately, 90% of my patients, they go and buy a stationary bike, and in a week's time, the husband says that they are only hanging clothes in their purse, and it's not used for really cycling. And then it stands there in the middle of the house like a white elephant with nobody knowing what to do. So we have to be very sure that you're going to use it. So I tell them to join a gym to do a stationary bike. If they're comfortable, only then buy it. The third thing is, third one, which is quite accessible to a lot of people, is swimming. freestyle, breaststroke, or any strokes in water will always help. Water has two advantages. It elevates gravity and the resistance is uniform. These are the two advantages of swimming as a aerobic exercise. Both swimming and cycling are gravity assisted, or it's not anti-gravity at all. So that way your knees and your lower limbs, which bear weight and bear the shocks, are less prone to injury. Then you have dancing. Dancing is proving to be a very popular form of exercise, especially amongst the youngsters. It has a lot of zest in it, and a lot of my younger patients look forward to their Zumba class. So you have Zumba, hip hop, salsa, so many other styles, and I like the youth that comes out when in their dance, and they really enjoy it, and they are doing their part of fitness too. Uh, Age-old aerobic exercise, jumping rope is also a good, great cardiovascular workout. Aerobic classes, you have group fitness classes, which also have high intensity interval training with them. We'll talk about that later. But I would subscribe to what Raghav sir said, that casual walking is not going to help you in your cardiovascular fitness. It is brisk walking for an extended periods. We may give some marks, which I'm sure Raghav sir may not give any marks. But probably I may give them about 4 on 10 for brisk walking. Something is better than nothing.
Yes.
Staircase climbing, again, using stairs is a very popular method of people who cannot spare time off their busy schedule, but then they take the stairs, they do their quota of aerobic exercise. The problem with stair climbing is it's not consistent unless you make a definite plan for climbing stairs. Nowadays, you get rowing machines for a full body workout. Rowing machines are also a non-weight bearing sort of exercise, which also helps, and elliptical training. So there's so many different ways of aerobic activities. What Raghav sir said is what I stand by, that you need to be breathless enough that the other person on the other end of the phone, if you're talking to, should tell that you seem to be doing exercise. So you should pant as much. So these activities can improve cardiovascular fitness, help with weight management, and boost overall health. But you must choose the one that suits your performance, your fitness level. And I think the baseline is you must enjoy what you're doing.
Yeah.
Done, Dhiren, is that okay?
Yeah, so I think you have covered it well, that there are various options. It's not only the brisk walking is or the running is the only options. There are various ways by which you can carry out aerobic fitness. You explained it from the orthopedic surgeon's point of view. I will ask Dr. Manohar to, from the internal medicine expert's view, if we want to explain the orthopedic community, that what are the benefits of aerobic fitness?
So basically, we can look at it in two different ways. One is to reduce our health risk hazard. Like by working out, we strengthen our heart and improve our clogged arteries and also improve our immunity. And most important thing, which is least told, is boost our mood and also our immunity. So I can clearly differentiate a day when I have had a short, fast run from a day from when I have not done an exercise, because my mood is totally different on those 2 days because of the good hormones what gets secreted, endorphins. But if you want to look at for the doctors, if you say, and you want to look at as acute adaptation and chronic adaptation, a bit of a lengthy thing. In simple output, if you look at it, if you look at the heart, in acutely the cardiac output and heart rate increases, but in chronically it improves the VO2 max and actually reduces the heart rate, and in the blood pressure also gets reduced. If you look at the beta cell function, again, in the long run, it protects the beta cell. If you look at the liver, we need glucose during that time. So there is increased glucose output, and contrary to the belief of many of them, a acute burst of exercise can also cause hyperglycemia. But in the long run, it improves insulin sensitivity, increases fat oxidation, and improves glucose sensitivity, insulin sensitivity. So in the blood flow, there is definitely, both in the acute and the chronic, it improves blood flow, vasodilatation, and increases delivery of oxygen there. And in the muscles, if you look at it, it improves glucose uptake. And that's why the sugar also comes down. And in the long run, it builds the muscle fibers to an extent, not to the extent of the anaerobic exercise, but definitely it improves the mitochondrial function. So both acutely and chronically, there is some definite benefit of doing aerobic exercises. Sometimes it is contradictory. Like for example, in the cardiac, if you look at, it causes tachycardia, but in the long run, it helps to cause bradycardia and improve the stroke volume. And in the glucose also, it increases hepatic glucose output, but later improves the insulin sensitivity and reduces the insulin resistance. So it is a very beautiful form of exercise. Always we should mix and match. And as Dr. Srinivas and Dr. Raghav told, enjoy your exercise, most importantly, and don't overdo it.
In your practice, have you seen any patients like increasing the stroke volume after exercise? Have you measured it? Yeah, theoretically, we always read in the book. But in your practice, have you observed that in any of the patients?
No, I don't think we have done any ways to measure it, honestly. But of course, I have seen in myself itself, the pulse rate,
the pulse rate definitely goes down.
But stroke volume measurement is very difficult on a day-to-day basis for practicality unless someone has any other ways to do it.
Okay. So before we go into the depth of the details, I would just like to ask you about, we will start with Dr. Raghav. What exercise do you do? Like if you look at or tell the whole week plan, we know that there are 4 types of exercise: aerobic fitness, strengthening, that's weight lifting exercises. The third is balance training, and the fourth is flexibility. So how do you compile that your weekly schedule of exercise so that all the 4 are covered?
You know, as in my last talk, I said that I was playing cricket as a young man and as a kid. But today I play 6 days a week tennis if I'm in Hyderabad. So mostly traveling and conferencing, as you know, we all travel so much for all these conferences. And if there is no rain, because I play in a clay court, I do play tennis for 1.5 hours, 1 hour, 15 minutes to 1.5 hours. It is so true. I always recommend the group activity. The advantage of group activity is that you have a WhatsApp group, and if you don't come on that day, there are 20 people questioning, why the hell have you not come? What are you doing? Are you coming tomorrow, doc? Questions like that. So you're forced to come there, even if you sleep late, number one. And in groups, you form teams rather. So 4 or 5 of us play always doubles together. So that gives me all the agility, the muscle strength, the quick movement in tennis that you need to reach the ball, and also gives me the joy of playing tennis and interacting. And as I said, we have 4 orthopedic surgeons in our group, and I'm the president of that club. And the first thing I tell them, any one of you doctors talk medicine, I'll send you out of the club. So we meet non-medical guys, the IT guys, there are some judges, some lawyers, and some businessmen, and all sorts of students, youngsters. So we have a very good interaction with them when you talk to them in between when you stop. So this is what I do. But whenever there is a half marathon or full marathon, I practice 3 to 4 days of running. And because mostly I do these half and full marathons, I do the endurance training. That means I'm told not to look at the number of kilometers I run, but the number of hours I run. So for example, in the recent full marathon, for about 4 or 5 months, I was running 10 kilometers, 1.5 hours, 2 hours, 3 hours, 4 hours, and then stop. So if I do 2 20-kilometer runs, I stop. Rest of the days, I go play tennis, like that. So I mix these 2 activities. That's what I do.
So you rely mainly on tennis for like giving you all the 4 sorts of exercise?
100%. I rely on that.
Okay, good. Yeah. Dr. Rao, what is your plan? Like, how do you schedule that?
Yeah, so I was like Raghav sir, I was a tennis player. I used to play a lot of tennis in school, and then there was about 10 years of gap because I thought I don't have to do any fitness. At 40 years, it suddenly dawned on me that I must start doing something for fitness. I took to tennis, and wow, it gave me my childhood back. And in that time period, I forgot that I was on the other side of 40 and I tore my meniscus. Then it took a long time for it to heal. Dr. Anand Joshi operated on me. And finally, when I got fit, I decided to switch over to cycling because that is more knee friendly. That's what I thought. And cycling really continued to give me my childhood back as I got the breeze on my face when I sped on the thing. And nowadays the roads are also good and the cycles are also good. So that has really helped me. My problem was that I injured myself even in the cycle. I fell down and I had some problems. I had a non-healing ulcer. And so I decided to shift to something called a tracks bike. A tracks bike is a bike which is the rear wheel is mounted on a machine which is connected to my computer, and then it will give me the same terrain as the real terrain. So I can say I want to cycle in front of Buckingham Palace or Central Park in London or Central Park in New York or opposite the Taj Mahal. So there are apps which give us the exact terrain. And when you ride the bike, you'll have to shift gears. You will pant when there are slopes. You'll take a bump when there are bumps. You might even find Dhiren Ganjwala cycling in the same area, and then they will ask me, "You want to cycle with Dhiren?" And I can do that all in the comforts of my study room. So I'm safe. So I now do that. I go out occasionally because Rajkot is a small place. So if I want to go, I cycle about 30 kilometers, 35 kilometers in one go. So if I want to do that length, I need to go to the highway. So then that becomes a little dangerous. I'm a little scared. And so is my family. So they keep saying, no, no, you do this, you do this. So sort of I have once a week, I go out on the roads. Twice a week, I do it at home. And the other 2 days or 3 days, I do strength training and balance training at home. I've got a personal trainer coming.
So you try to distribute your weekly
Yes.
schedule into the 3 days for the aerobic fitness and the 2 or 3 days for the balance
Yes.
two and the strength
training. It's
training.
also important to put a point that it is extremely important to rest on for 1 or 2 days a week, so that your physiology can recover from whatever little insults you're giving it.
Okay, and then just one question that how do you adjust your aerobic fitness and the strengthening? So it's like the first 3 days for aerobic fitness and the remaining 2-3
No,
days
I
for
do it
the strengthening.
alternately. I do it
Okay,
alternately.
so that's another important point.
Yes.
That's another important point.
Yes.
Okay, what about you, Dr. Manohar? What is you are 45 only, so you must be much more aggressive in the exercise.
Yeah, initially I was only into running, and now in between I got only into strength training mainly. And of course, I used to do some flexibilities in between these two. Now I'm trying to strike a balance between both and do and enjoy everything what I can do. I'm not so much into cycling at all. Somehow I'm scared to cycle in Bangalore, and so I usually do running and strength training. And of course, I spend once a week definitely on flexibility and yoga and meditation. But that's how it is mixed, and I need to definitely give a rest for a day or two. Sometimes it comes off even unwantedly. The rest comes because of the schedule, but even consciously, I put a day for rest.
Yeah, so all of you three are busy practitioners. So just a quick question: of 4 weeks, let's say at 28 days, how many days you carry out exercise? Dr. Datta, yeah.
About easily 23 to 24 days in a month.
And the remaining 4 are for the conferences and all that.
See, Monday is a rest day for me.
Okay.
Our
So
tennis
you
courts are
exercise
packed.
on Sunday and then rest on Monday.
Sunday, I play almost 2 hours we play because, you're free and you don't have to go to hospital. So Monday is my rest day, off day. Yeah, so that takes away about 4-5
4-5
Mondays.
days, right?
Yes.
Okay. So so the 4 are the Mondays, and then it comes to 24 days in a month.
Easily.
Yeah. What
Minus
about
the
you?
conference days.
Yeah. What about you, Dr. Rao? Because you are now president of Gujarat Orthopaedic Association and having a lot of stress and the burden of managing the association.
I will be very honest with you because my wife is not here. I would put it as about 20 days a week. And if I'm a very good boy, then 22 days.
Right. And the remaining days are like a purposeful holiday or because of the busyness?
They're forced holidays because I enjoy my workout and I look forward to it. And my other problem is I'm a very early riser. I get up at 4:30, and if I don't do my workout, then I do Amazon shopping. So it is always cheaper to work out.
Okay. And what about you, Dr. Manohar?
4-5 days a week, and like Raghav sir, Monday is usually my rest day. And again, I'm the chairman of Karnataka RSSGA, and we are doing the program in December, so I'm slightly busy now. But I'll definitely squeeze in 4 days, mostly 5 days.
Yeah. So biggest
In a
problem,
week.
for us is whenever we become busy, particularly like organizing some event or some social event or something like that, the first sacrifice is on the exercise. So that is one of the sad thing, but that is what the first compromise is.
Here, one point I would like to add.
Yeah.
Some days we feel so guilty that we are not exercised. Someone who's doing it regularly. So if there is a rest which is forced or unplanned, or you scheduled one, I always tell you, please enjoy the rest. If you are not exercising, I should have run, I should have lifted the weight, I should have cycled. Instead of cribbing about it, I have extra 1 hour. I want to spread my legs or just lie down. You enjoy that is what one message. Otherwise, whole day we'll be thinking, I didn't do. And it gives more unpleasant things to the mind.
Yeah.
Okay, so after understanding the basics of aerobic fitness, now let's deep dive to a slightly more technical understanding. I will start the first question because Dr. Manohar already mentioned about the VO2 max. So can you tell us something about what is VO2 max, how to measure it, and do we have any facility in India where we can measure it reliably?
Yeah, honestly, it is a very tough question to ask. How do we measure intensity of exercises? I think the best measure is what we feel about it. Even though the rate perceived exertion scale also by and large says that 0 to 10, nothing at all to very, very heavy exercise you felt. Because VO2 max, MET, yes, it's not routinely done. And even though now the watches are available, which possibly gives a reasonably good accuracy, but still it is doubtful. So what I would say is you please enjoy the exercise, whatever you do, how many METs you do. So if someone wants to know what is MET, metabolic equivalence, it is usually the amount of energy what we spend during sedentary, comparing it to light, moderate, vigorous, or high intensity, from where you go to 1.5 to 3 METs will become light, and more than 9 METs will become high. Similarly, VO2 max is important, is usually in brief, to understand it, it is a maximum rate of oxygen consumption measured during incremental exercise, typically on a treadmill. So now how do you go about measuring it and how reliable it is always very debatable and questionable. So some people calculate it by dividing your maximum heart rate by your resting heart rate multiplied by 15.3. So others say, so okay, you do a lactate or power cycling test and try to find out. And of course, there are a lot of watches, gadgets which are available. Again, always very disputable. We can't have a one point towards it. So if you look at someone who is 40 to 50 years male, someone who has 31 to 35 VO2 max is considered to be okay or fair. If it is 35 to 40, it is good for males. And for the ladies in the same age group, 30 to 33 is also considered good. But again, it is not very easy to measure, calibrate, and reproduce it. So best measure is always you enjoy it, what you're doing. And of course, the gadgets definitely give some measure to it. And also a simpler measure again is how you are getting adapted is how your heart rate returns to the baseline at the end of 1 minute. Heart rate recovery at the end of 1 minute also is a good thing. And when you start doing regularity maintenance of the exercise, then it starts recovering earlier to the baseline also. So I think, yeah, to max is important. Very still in the current situation, very theoretical. Yes, there are watches which can tell us maybe it's the Apple Watch or Garmin Watch, maybe better. But again, it's a bit still arbitrary.
Okay, right. So basically, for all practical purpose, we have to build our exercise protocol without such investigation, because now we have a watch which gives us some calculated or estimated VO2 max, but that's all estimated thing. Without actually measuring the oxygen consumption, we cannot decide what is VO2 max. Now, I would like to ask Dr. Raghav Datta about another very popular term which is becoming zone 2 exercise. So can you explain us something about what is zone 2 exercise?
This is a good way, actually, zone 2 exercise. After you do basic exercise and get some fitness, that's what I would suggest. This is a sustained exercise program. It's not a mild exercise like walking, nor very heavy, high intensity exercise. It's a sustained, moderate exercise. And this you can do it at a given time for you, and you continue to do that exercise. Basically, that's what it is. Suppose if you're, just to give a crude example, if you're running at 3 kilometers an hour, for example, on your treadmill, that's a very basic speed for a fit man. So at 12 kilometers per hour, that becomes a very high speed activity for anybody. So if you're doing around 6 to 8 kilometers per hour speed, so that's it focuses on working on a moderate intensity level, and it's a sustained exercise. You do that, and that's a very good way of exercising your body, provided you have achieved some amount of fitness. Then you go to this zone 2 exercise programs.
Right. So basically, it's a moderate intensity exercise, which you
Yes.
do it for a longer period of time.
Longer period of time.
Right. Yeah. And then another terminology, which is time and again we hear from the person who is very fitness freak, is about the Tabata. So TABATA. So what is that? Dr. Rao, can you explain us what is Tabata regime or something?
Right. Tabata, with a very interesting name, is a high-intensity interval training workout. It is a workout method that was developed by a Japanese researcher called Dr. Izumi Tabata. And this was sometime in the 90s. Now, one of the reasons why he got this out was it was for the busy executive who kept complaining he doesn't have the time to do it. And that's how it actually surfaced. And it consists of very short bursts of very intense exercise followed by brief rest periods. Now, traditionally, the Tabata workout structure includes 20 seconds, just 20 seconds, mark me, 20 seconds of intense exercise. During this period, you give your best, you give your maximum effort, often performing exercises like sprints or squats as fast and as intensely as possible. And this 20 seconds of intense exercise is followed by 10 seconds of rest. After that, after the intense phase, you rest briefly to recover, and then it's not over. You repeat the cycle. You repeat the 20-second exercise, 10-second rest intervals, which is half a minute, for a total of 8 rounds. So it adds up to 4 minutes. So that's the traditional Tabata exercise pattern. It's a high intensity 4-minute workout, which is supposed to be known for its efficiency in improving cardiovascular fitness and burning calories in a short amount of time. It is important to perform exercises with proper form and consult with the fitness professional, because this high intensity interval training, this Tabata, is not for beginners. It is for seasoned people and for people who are used to exercise. So we can't go straight away on that fifth gear, or otherwise the motorcycle will stop. So you have to go gradually and then build yourself up to do a high intensity training, and then probably in 4 minutes or 8 minutes you can finish your day's workout. A lot of wishful thinking, but it's not as easy as it sounds. It's very exhaustive. Is that okay, Dhiren?
Yeah, so what I gathered from you is that the only role of Tabata is for those people who are not able to find time.
I think so, because otherwise you are running the risk of injuring yourself, especially if not properly trained.
Yeah, because as you
Yeah,
described, please.
I remember doing Tabatas during our group sessions. It is real fun with the younger crowd, and that is there. But it is more for time saving gesture also. But sometimes it adds fun to your exercise workout, and it's good to do it. If not, like what sir said, is a textbook Tabata. So we usually modify it accordingly.
You can modify it.
You can modify instead of 8 rounds. Sometimes we do 3-4 rounds. 20-10 instead we do 20-20, rest also for 20 seconds and things like that. But again, we suit our convenience. We don't want to impress anyone here.
Yes, exactly.
We should suit our convenience.
Exactly. You have to be very clear. You're doing it for yourself and not for others.
Please.
I have, I think last time also I talked about this. I would certainly be very careful with this exercise program. The CrossFit is an exact copy of that. And there are two things. These sort of exercises are very good for somebody like Dr. Rao or Manohar, but you need to be very careful. Why we need to be careful? Because there are some instances where if you have a plaque in the coronary artery, it could migrate down and cause heart attacks. And number one. Number two is, I don't think, I'm told, I may be wrong, but Tim Cook, who is the CEO of this, Apple computers and all that, apparently he does a hell of a lot of exercise every day. And very few Indians can be as busy as Tim Cook, certainly. And we practicing orthopedic surgeons, we are the busiest doctors in the country, endocrinologists, all of us doctors in India are extremely busy. And we don't have weekends like abroad. Like, I spent 10 years of my life abroad working. And so I know how it is. So it's very tough life for us here, morning till night. And we have time to exercise. So where is this hurry to exercise? Number one. And we hear of youngsters dying because of this aberrant pathways, this heart, the activity, electrical activity of the heart not going in the right pathways, as we read in physiology books, going in the aberrant pathways, not reaching, you may die. So I did CrossFit for a while, for a year, and I found that it is not a good activity at all, but I could do it easily. There's no problem. It didn't affect my heart or lungs or whatever. But as a general prescription, you need to be very careful, especially people above 40 and other conditions. Yeah. And if Indian Prime Minister, who is one of the busiest jobs in the world, has time to do yoga and all that, certainly every executive has time to do yoga. It's just that spend time on this thing. That means if an executive, if he has no time for exercise, that means he's a bad taskmaster.
Bad planner.
Bad planner.
Yes. Right. Yeah. Yes. So now already you have taken that area, and one of the major concern is about problems. So there are two types of problems which we come across. The one is the orthopedic problems, and the second is the cardiac problem, which you already described. So these are the two major concerns. So I would like to ask you first, what orthopedic problem have you faced, minor or major, because of exercise? And what you have seen, because you said that you have a big group. So a lot of people must be asking your advice also. Yes. So what are the common problems you have seen because of exercise?
See, most exercise is problems are because all of us, including I am guilty of that, is we don't do stretches and we don't do proper warm-ups. Because, when I'll talk about tennis. someday you are a bit late and your players are ready and say, start, join us like that. So proper warm-up will lead to a lot of injuries. And some of my friends' children who have gone abroad for tennis coaching, high-end players, and these kids, if they play for 2 hours, they're made to exercise for 3-4 hours. So in India, we are not trained to do proper warm-ups and stretches and all that. So it is not in our psyche, nor in our training. So this leads to 2-3 injuries. One is the knee injuries, right? Your meniscus, as Dr. Rao had happened. So that can happen, number one. And ankle injuries are very common when you suddenly slip and twist. So you should have good shoes, the tennis shoes and all that. And third thing is we see a little bit of wrist sprains, little bit of tennis elbow sort of, epicondylitis or, injuries, and mostly the shoulder injuries we see. But every one of them is transient. So with a bit of rest and bit of physiotherapy, they get better and they come back to playing the game. Very rarely, I injured my knee 3 times and now have developed a bone-on-bone arthritis in my joint. I don't have pain. I have a bit of stiffness, and my knee flexion is restricted about 120 degrees. And this is going on for about 7-8 years. My MRI has not revealed any meniscal injury. And once in a while, I get a little bit of strain in my wrist because I do a very good forehand shots. So just to prove my point that because I'm in my late 60s, I want to compete with the youngsters just to show off. So that's another problem. But this has not prevented me from playing tennis, nor from running. Because I'm of the view, being a diabetic for the last 26, 27 years, I would want my knee replacement or whatever surgery that I would want require at a later stage than stop playing games and sports, because I know the horrible consequences of this diabetic, which I think is the worst disease apart from perhaps cancers that a human being can get. So injury should not be a deterrent for playing games and sports. If you're too worried, cycling is a fantastic thing. It can be a solo activity or a group activity. And as Dr. Srinivasa said, it's a fantastic thing for the knees. Excellent cycling for the knee joint.
Okay, so you already covered that the warm-up is the most important thing.
Yes.
The second part, which is also we are not doing, is about the post-exercise stretching.
Yes.
So what do you think about that?
We should. A lot of my friends do that. But you see, we are, this is a problem with our doctors. The mind is on the patients. I'm a spine surgeon, so, I have to rush there, long surgeries, mind is on all that, the scoliosis or, degen spines and all that, all that. So for surgeons, the mind is on surgery. Your team starts the work, the anesthetist. So 3 to 4 days, you are under that time, what you call shortage of time, I would say. So it's a very good thing to do, but perhaps I should say that I'm guilty myself of not doing
the post
stretches. But I would strongly recommend that.
Dr. Manor, what is your take on that about the problems yourself you have faced and you have seen other facing, and the tips to avoid them?
This is regarding pre and post exercise stretches you're talking, sir?
Any problem which you have faced in your journey of last 20 years of exercise?
Some multiple problems. I always say I'm almost always injured somewhere or the other because I try harder than usual. So first thing is, when you wake up in the morning, if you don't think you are well rested, don't do anything. And when you don't do anything, you enjoy that rest or whatever you do, listening to a song or whatever you want to do. So please don't keep on crib about it. Second is hydration, equally or more important and neglected. Please don't go just by the thirst mechanism. Thirst is not a very great indicator of it. And if you are sweating, again, if you're based on the long duration of exercises, we may sweat up to almost a liter or more based on our condition. Of course, it could be different in Hyderabad or in Ahmedabad, but at least around that. And when you hydrate, we should also remember that salt and sugar content part of it also is equally important, not just plain water. And no need of overhydrating and taking too much at a time. It has happened many times. I've seen the runners when they start drinking a lot, 2, 3 cups, and they start vomiting. Two causes. One is gastric dilatation because of sudden influx, and because of hypertonic solutions is what we take. And slowly the gastric also gets water into it to dilute it, and then it causes dilatation. It starts vomiting. People start vomiting. So again, as beautifully sir said, Dr. Raghav, pre and post stretches are important. If you look at the literature also, there is a very biased opinion. Some say pre is important, post is important, some say nothing is important. But I think we should maintain a system for it and follow it religiously. Both pre and post are equally important to prevent injuries. Anyway, we are not trying to work out to become Mr. India or impress someone else. So we need to prove that or to catch the traffic. If I'm not as busy as the surgeons, at least to beat the traffic, I sometimes they will let me stretch in the car or just do something. Thoughts come to us, but I think we should try and beat it. So I think exercise again. Coming to the point of what you said, heart, plaque rupture, or whatever. Again, for example, when I was running the last Sunday half marathon, I got prepared well for it, and I could see my watch clocking 170 beats per minute almost throughout. So that was a warning for me to not to speed further, even though energetically I was feeling I could chase the target even 5 minutes earlier. But I started realizing that heart rate was not slowing down to that extent. That means it is a warning that already heart is stretched to its full. So I finished the second half in almost 1.5 hours. The first half I had done it within an hour. So I think that consciousness, especially when we are talking to our own doctor fraternity, at least that consciousness about how you feel is very, very important. And try not to push. We are not going to achieve anything by pushing it. And we have to compete with our own self, not with anyone else.
But the point which you mentioned is very important. Like say, you are, I think, 45. So your the maximum heart rate 220 minus 45, so that comes to 175.
Yeah.
So almost you are at the 100% of your target heart rate, which is really a very, very risky thing.
So as I realized, I thought better slow down, or if I'm feeling discomfort, I'll just stop it or reduce the speed. So please don't push it. Physically, I was thinking of pushing it to try to get it a better mark, but I think that is wise not to push it.
Right. And Dr. Srinivas, like, what is your experience about your? You already mentioned about your meniscal injury.
Yes. So I've had two problems. One is two mishaps. One was this meniscal injury, which changed my type of aerobic activity that I was doing. The second was that I, like Dr. Raghav, I am also a diabetic, and I had a bad fall, and then I had a non-healing ulcer. I had to undergo 2 surgeries. So I'm a little scared now of going out. Having said that, I want to underline the fact of the warm-up and the post-workout stretches. Nowadays, they say as much as the game, so much the warm-up. So, of course, I don't know what the cricketers do if it's the one-day game, whether they do a warm-up. But you need a long warm-up. Now, when you do a warm-up, what you do is dynamic stretches is what you do in a warm-up. That improves your flexibility. While post-workout, what you do, the cool-down, is static stretches. There you don't need the dynamic stretches. There you need static stretches to relax the muscles and to improve the blood flow so that the lactic acid is washed off. The stretches and exercise help to improve your flexibility. It reduces muscle tension, and there's an enhanced recovery because the blood flow to the muscles are increased. It helps in removing the waste products. There is, of course, injury prevention. It can identify any areas of tightness or discomfort. And don't forget, there's also mental relaxation with this. One more prayer is that I tell my patients to be sensitive to pain. Pain is a gift of God given to warn us of something going wrong. So we must listen to it. And then taking a painkiller and still doing your exercise, trying to prove your sincerity is not one of the smartest things to do. So you need to respect pain, let the pain subside. I don't say we need to stop exercise, but you can do it at a much reduced level. The secret of success continues to lie in perseverance.
Okay, thank you. So let's go to the next point, and that is about the hydration, because that is one point which is not really discussed well in our literature or in the sports book also. It differs from city to city, whether it's a Bangalore, fine, it's a cool weather compared to Ahmedabad, Hyderabad, or Rajkot. So, what is your take on that? And particularly, we would like to understand about the long exercise when you are doing it for more than 1 hour, where hydration really becomes important for the subsequent part also. Like you are in a marathon, you are running for 4 hours or more. So, how do you hydrate yourself? Yeah, Dr. Rao, please. Sorry, Dr. Manohar.
Yeah, I think I just touched upon it. I think it's very important. Some people do pre-long runs or pre-long workout hydration. Sometimes we overdo it, and when we take these hypertonic solutions, whatever you take, like Energol or any other energy drinks or simple salt water mixture, sometimes you have diarrhea. So if you overhydrate, body will store it only for a few hours more. So no point hydrating yourself for 3-4 days before. Having said that, you should be adequately hydrated. Take concentration for about salt and water both. Of course, salt includes sodium and potassium. Typically, the sweat rate, as you said rightly, depends on the humidity and hotness of the climate and the type and the wind speed also. Roughly around 1 liter for a moderate to severe exercise. So keep that in mind. And of course, if you are a diabetic, always keep a look at your glucose. During also exercise if possible, if you're doing more than your ordinary activity, definitely pre and post exercises. And during exercise, try to ingest smaller volumes of fluid. If you take too much, it causes gastric discomfort and vomiting sensation. And electrolyte imbalance should be kept in your mind. And each of us may be slightly different. Some of us are less sweater, some of us are hyperhidrotic and they keep sweating like anything. So all those things should be slightly individualized, but definitely hydrate. As you really said, that the most negative stuff which you need to keep in mind. Of course, a lot of the energy drinks also has calories added to it, so we should keep that also in mind when we do.
Okay, but there are three things when we remember the hydration. The first is the fluid, the water part. The second is the electrolyte part, and the third is the glucose part.
Look,
So, yeah, what is your take on that? Like, so can you suggest like what do you use while running? Like, say, last Sunday you ran marathon. So, what was
yeah,
your fluid intake? Can you and which fluid? Is it ORS or something else?
I think to be honest, I usually make of this, and I go by what I feel. Try to be in place. Also, crawl. Also, sometimes they keep with and fast. And
Your voice
balance.
is breaking. Yeah, can you do something with that Wi-Fi or
Is it better now?
yeah, please.
Don't carry my own weight, even there are some people who do that. So sometimes I balance it out with what with is kept, and also just salt and jagged to add activity. We should accordingly. So when you start somewhere, you we again don't wait for us and campaign. Then see more salt water. But if you overdo the activity, and you will have loss also. To be safer, be 1 liter per hour is what just at a good amount of, but definitely some amount in based on where conditions you're running. And of course, calories again. It's difficult to calculate on how much you require. We base it on our past experiences, and it should be visualized around. I'm not a definitely, and so around extra of I do it over and they
Yeah, just sorry to interrupt. There is some major issue with your Wi-Fi. So if you can switch over to the other system, that would be better.
Oh, I don't know. Nothing has changed. Hello, am I audible now?
Yes,
Much
this
better.
is much better. Much
Much
better.
There was some problem with the headphones. Sorry for that. I think I don't do a perfectly calculated intake, which is usually again very theoretical. So before the long runs or a long workout, you hydrate adequately. Don't have to overdo the salt. Otherwise, I had diarrhea sometimes when we started taking high concentrated solution, and it happens to many of us. So try not to, because the salt and the water are not stored for too long, unlike the carbs. So carb loading is okay. Water and salt adequate enough is good enough. You should not be negative. Definitely, if you are slightly positive, it is good enough. And while on the run, you go by your instances. If you're doing it for an hour, at least 1 liter of fluid with adequate amount of salt and carbs is what you need to keep in mind.
Okay, fine. So that's a very good suggestion for the hydration part. And yes, most of the time we tends to neglect on that, probably to do it something more or sometimes less. Now we are coming to the like only 4 minutes remaining. So we will take two questions. The first question I would like to ask Dr. That a lot of patients with the degenerative spine must be coming to you. And what is your advice to them? Do you suggest running, walking to them, or like you suggest something else?
Yeah, if you look at any degeneration of the joint, for example, spine is a very common area for degeneration, especially with sedentary lifestyles and all the gadgets. It's increasing also. Now, what happens to degeneration? When there's a degeneration, if you look at spine, there's a degeneration of the disc, there's a degeneration of the facet joints. And because of this, there is pain and stiffness. And because of that, there is less exercise and patients tend to take rest. And that's again another thing which I call doctor disease. I've written on this. It is telling people to take rest, rest, rest. You get backache, 3 months bed rest. And that is going on till today, not only here, everywhere in the world. So as Dr. Ved Prakash in Hyderabad says, rest is rust. So what it does, it causes wasting of the muscles. We see that, for example, if you have an effusion in the knee and there is pain, very quickly the vastus medialis and the muscles around the knee, they get wasted. Wasting leads to less movement and more stiffness, and that will lead to further degeneration of the joints. Now, if you say take spondyloarthropathies, as we know, the joint nutrition comes from the synovial fluid. And the more we move it, the better the nutrition for the joint. Now, for example, if we have stiffness of the knee and our knee bends only to 90 degrees or so, it wears out much faster. So the fundamental thing to do in a spondyloarthropathy or a spondylitic changes we usually call is to start stretches. So that will increase for example, a wasted muscle is a shortened, contracted muscle. So when we do these stretches, neck stretches or back stretches, the muscle gets back to its original optimum length. And we all know from our physiology that is extremely important for muscle function. So I tell my patients with these conditions to start stretches. That's what they should do. Whatever the pain, they must stretch. They should bend forwards and backwards. So we all tell our patients, don't bend forwards, don't bend backwards. It is lifting weights is different from bending forwards and backwards. That is a stretch. Once you do those stretches, then automatically the nutrition of your joints improves. The hydration of the disc improves because of a diffusion of all the nutrients from the end plates. And that leads to a much better spine. And once you do pass that stage, then you improve that by exercise programs of your choice. Now, just want to add, somebody has put in the chat that Dr. Hegde says that running is bad. Well, Dr. Hegde has his own views about modern medicine, which I'm sure 90% of doctors won't agree with everything that he says. Right? I mean, audience likes it. Doctor bashing is a funny thing, and pharmaceutical industry bashing is a pastime for all of us. But we all know that these are very important. So, except for a few individuals, running is very important. And you have to remember that we are part of the animal kingdom. We are not human beings, we are Homo sapiens, and we lived our lives hunting, running, climbing trees, and all that. So, not to run is against the fundamental existence of us human beings. If you can't run for various reasons, that's a different matter. But to go around telling people that don't run is anti-science.
Okay, thank you, sir. So you wonderfully explained, and I think,
Yeah.
yeah, and Dr. Rao, I think probably for the knee joint osteoarthrosis, you will also follow the same thing. You will start with the stretching.
Yes, I would add resistance exercises to the quadriceps because usually they are wasted. And again, I'll tell them that the high impact exercises are not allowed. Walking, cycling, swimming are definitely allowed. And the secret of success again lies in perseverance.
Okay, just one thing, like I would like to say, Dr. Raghav that also has osteoarthrosis of the knee joint, but still he plays tennis and still he can run. So, like he's an exception to that, but it's not necessary that all the time we follow the strict rule, no, 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 because usually we as a doctor have a tendency to restrict activities by one or the other mean. So that's not the right way of dealing with the patient, because in a long run, when we restrict, the muscle atrophies and then it leads to more problem than solution. So with that, we had a wonderful discussion in last hour, and we discussed various aspects related to exercise, starting from advantage to the problem, and the last is how to avoid problems. So thank you once again, my faculty, for sharing your experience and knowledge with us. And I'm sure that we will continue discussion in the subsequent webinar with some different topic. So thank you, everyone.
Thank you,
Ortho
Dhiren.
TV.
You were a wonderful moderator.
Thank you very much.
Yeah. Thank you.
Excellent.
Bye-bye.
Good
Thank
night.
you. Good night. Bye-bye.
Yeah.
Lovely
Bye, sir.
interaction.
Bye, sir.
Yes.
Thank you.
Yeah.
Thank you. Learned a lot. Thank you, sir.
Thank you.
Recording stopped.